Hello, good afternoon. I think we're live now. Thank you all for joining. We've got 26 members I can see watching us live now. Numbers increasing. I think Priyanka's just posted an update. I'll give another 30 seconds and then we kick things off. Thank you for waiting. 29 numbers now. Okay, guys, I'm going to start. Priyanka and Steve, let's go. Cool.
Sounds good.
Thank you, everyone, for taking the time to join us today out of your busy schedule. I know most of you are in clinics. We are very grateful. This session is also recorded for those who are unable to join. Obviously, only 1/3 of our working team are on live now. Rest can watch this recording later. For those who are new to the organization, these town halls we did previously monthly, and now we've switched them to quarterly. I think there's a very good opportunity for everyone to take a step back from their daily routine and see how their feedback and day-to-day efforts are shaping the bigger picture. We'll keep it short and sweet today, half an hour to go through around 35 slides in the deck. I'm going to kick things off. My name is Karan. I am the Director of Operations here at Penrose Health. I've not had the chance to meet all the new joiners, hence the intros again. I'm also joined by Steve Harding, our Head of People and Performance, who will be delivering some key updates on people function today. And we have Priyanka on board, our Growth and Marketing Team Lead, who will be going through her ongoing work around building a positive team culture in the organization. So lots of exciting updates for you, lots of things happening in this year, 2026. Let me start with the bigger picture, if I may. Right, the bigger picture here is our shared goals at surface level to a layman, to our patients. It seems like we exist to deliver appointments and provide repeat prescriptions, but we all know what we do goes well beyond that. So I've tried to break them down into 3 goals, starting with how we deliver timely and equitable service to all our patients, and the quality of service being safe and consistent. And then finally, what we can't do this without you, is how we support each other to be a stronger, more resilient and happy place to work. Allow me to dive into the access goal for a minute. I'm going to spend a couple of minutes talking about waiting time. This is seen as a good marker. Organizations across NHS see waiting time for routine appointments as a good indicator for timely care. Now, we've been watching the trend. On the screen, you see last 9-10 months of data. 3 lines, GP line is green, the blue one is nursing team, and AHPs are in blue. Our goal has been to keep all 3 trends below 2 weeks, and we're doing well with AHPs, definitely under 8 days. Nursing team's gone up slightly, which shows probably a sign of distress, probably a capacity issue, and I'll talk about that more in detail in the coming slides. GPs saw a little increase in January, probably due to the after effects of holidays, and we had some unexpected leave, but we seem to be recovering from that. It's important that we keep monitoring this because that's a huge indicator on how people or our patients perceive us delivering care on time. The second indicator that has always, recently been in discussion across the organization is how patients reach out to us. Phone line remains most widely used mode of contact still. I mean, we have very few coming by email, around 100 emails a day, or less than 20 AQRX a day, but most of the patients reach out to us by calls. We're now taking 25,000 calls a month, and majority of them are going to London Bridge, and there is no doubt, we all know that they had some challenging days and weeks in the last 6 months. You can see that in the data. We've been quite open about it. So essentially, October, November, December, London Bridge team was struggling with taking the amount of calls, but they have been very resilient and bounced back. The wait times are much lower in January and even lower in February. Obviously, we're still in February, but the numbers are looking good. The goal has been internally to answer calls within 6 minutes. And if we are promising a call back, we want to do a call back within half an hour. We are towards the right. We are the trajectory looks good. We're taking most amount of calls, and the performance of the team does suggest that they are on the right path to achieving those goals. It's obviously very tricky, but the team has seen a lot of new starters, a lot of time gone in training, and we're now starting to see the fruit of that. Another key initiative we had in London Bridge was around clinical oversight. The aim was to reduce duty doctor workload coming from London Bridge team. So we have Taryn, our paramedic lead, based there at London Bridge most of her time, supporting the team along with Emma, the dedicated GP that we now got at London Bridge. And this graph basically showing you the number of queries that the team was passing on to the duty doctors on site. I'm very pleased to see that there's been 30 to some months 50% reduction in the queries going from London Bridge to the on-call doctors on site. So this is helping us save some of the GP capacity on the ground. Now, obviously, having said that, these trends look positive, but there's still more work to be done. We need to make sure that we are offering the cover in a fair and a sustained way, because there is risk of burnout. So I've tried to outline these in 6 key areas. Definitely, some sites need a bit of increase in clinical cover because the list size have gone up. Some sites need GPs, other need paramedics and nurses, and hiring is underway to have them on board. We've also got 3 of our AHPs that are now being skilled to be prescribers, and once they start prescribing, we'll find that the burden on the duty doctor should come down because they are able to do prescriptions independently for the patients that they see. LMC is one of them. LMC's just got a new paramedic who will be prescribing for their own cases, which is a win for the doctors. We are also looking at the timing of the shifts, and this is driven largely by the observations we had from the urgent care and A&E data. We found that we were sending lots of patients to urgent care around the second half of the day, which is not necessarily seen. I mean, I don't see that as fair because urgent care is obviously staffed by GPs, and we should be self-sufficient to be seeing these patients. So what we're doing here is reviewing our team capacity and timing, shift timing, so we can offer more appointments in the afternoon and evenings. Triage of in-person bookings. I mentioned earlier that majority of the patients reach out to us by phone, and that stands true, but there is still a fair few number of walk-in requests that we see people coming in the building and asking for appointments. And we did an audit of that, an independent audit, and we found that the majority of these bookings were not appropriately booked, but there is obviously no one to blame here because the teams on the ground at the front desk are not equipped with the right training or the right tools like the post. They don't have any triage tool or clinical oversight. So the plan here and plan always was to reduce the in-person bookings and make sure every patient is triaged. So we will be executing that plan in March, politely redirecting patients' requests to the triage hub. Triage hub obviously is being equipped in the background to handle the additional demand. Strengthening of call handling. We talked about this, that they've recovered from a very busy spell. However, there's more to be done if we're taking more booking requests. Plus, we had our deputy lead there unable to return from long-term leave. So we're hiring more people there. And Steve will talk about the referral program in the slides to come. Some more work to be done on post for making sure that our pathways are correctly aligned with the capacity we have and the skill set that we have internally. We identified a few pathways that were resulting in urgent care and A&E referrals, which we think we can easily handle in-house with our upskilled AHP teams. So you'll see some changes there, and hopefully I'll be able to give you a positive update on this in the next town hall. Moving from access to quality of care, we have the quality outcome framework. Obviously, we're part of that. It's a national framework used as a marker to see how practices deliver care to their patients. To start with, this year, the cough actions were higher, so usually around 60 to 65,000 actions a year. This time they were touching 70,000, so we had a bit more work to do. But I'm pleased to report that the teams have done immensely well. I think the success belongs to all of you. We've already hit 87% of our cough targets and by the end of January. So we've got 2 more months to go, and we're positive that we'll achieve all our cough points this year. And a good little testament to that is LMC, Lewisham Medical Center, achieving an award. They were recognized in the GP Excellence Award in a ceremony conducted by ICB in January last month for achieving highest percentage of learning disabilities done in the borough. Congratulations to Anna and the GPs. I think this is a direct result of your hard work and dedication. Thank you, Anna. I've also shared some insights. This is very high level, talking about quality and learning, very high level on our significant events and complaints. We don't usually do this in town hall, but I think it's important that we touch on them going forward. Don't see massive fluctuations around significant events and complaints. There are some, but I think they're driven by the winter season demand. It's good to see. So the light red numbers you see here are the number of significant events we log per month, and the dark red ones are the complaints. It is positive to see that we have more significant events than complaints, because significant events are internal and they're logged as potential concerns before issues become real and have high impact on patient care. So it's great that you guys are logging it. There are some recurring themes around prescriptions and delayed referrals and results that have been highlighted, and we've done some targeted reviews on our SOPs and training protocols to avoid becoming this a real issue. Complaints, on the other hand, even though low, I mean, they're not massive numbers, receiving 10 to 14 complaints a month. If you compare that to 20,000 appointments that we deliver a month, it's a tiny number, still very important to monitor, as this shows us how patients perceive our services. The theme there was more around communication and consistency in following our procedures. Not necessarily to do with clinical decision making, which is reassuring. There was another interesting theme. I noticed that most of the complaints had multiple teams involved, which indicate to me that there's some work to be done to understand patient's journey throughout, patient experience throughout, and also need for clearer documentation and handovers. I've given a QR code here because most of the significant events we noticed were being logged related to lack of following the SOPs. So all our SOPs, just a quick reminder, are on Penrose portal. If you're not using it, please do. All our training protocols are there. So it's a very good resource. Patient experience, again, a little indicator for how we're delivering quality and access. You know that we send text out after each and every appointment delivered by our clinicians in-house. Roughly, we get around 900 to 1,000 responses a month, which is very high numbers, 10,000 plus responses in a year. And we've consistently scored 4.2, 4.3 at some sites, which is a healthy rating. There was a dip around winter season. I guess it's probably to do with access around that time. The phone lines were super busy, but we've recovered. We see the numbers rising, the rating rising again in January. Google rating, on the other hand, has remained flat. There was one site with a slight dip. But again, worth noting that the Google rating are roughly 4 months old, and Priyanka and her team are doing some work around getting new ratings, fresher ratings. So we know, so we hear from patients who've had experiences in the surgeries relatively in the past. Behind the scenes update, referrals team cracking on now. They've cleared their backlogs, roughly taking 3 to 5 days to process all the referrals. The urgent ones are done within 24 hours, and then 3 to 5 days are for advice and guidance and the routine referrals. Now, they did have some setbacks last week alone. Twice ERS was down, and that's something out of our control, but teams are doing their best. As soon as they gain access, they are able to catch up with the workload. Bathling's team, again, on top of their workload, they had some backlogs because of introduction of new pathways for them, working out the Q risks, but they are up to speed now. All results are being dealt with within 2 to 3 days. Safety netting, again, doing really well. All safety netting action points are taken within 3 days of the date due, sometimes earlier. Documents processing team is something that we were really concerned of last time we met. We spoke. There was introduction of AI tool called Anima, now being widely used by all team members and clinicians. We bring down the backlog from 4 weeks to less than 1 week. Only 2 sites have a backlog of 1 week. Others are up to speed. Medical reports team suffered a hit because we were trialing 2 pilots to outsource this service to providers who would claim to do our medical reports. We found their quality not being satisfactory, not adequate, timing wasn't adequate. So we end up killing the pilot and now continuing to deliver this in-house. But that set us back, and that's why the team's now recovering from backlogs. Vitals is something the reception team been focusing on. We call them welcomes team now. It was challenging for them, but we've had multiple trainings and discussions with the team, and now it looks like we are doing very well. January alone, we did 1,400 vitals. LMCs on top of charts. They're doing really well. 60% of patients 60% of patients attending the surgery are now being contacted by a reception team, and we do their vitals as they walk in. This is saving doctors a lot of, not mean a lot of time, but there's a fair bit of couple of minutes time, which doctors are very grateful for. Quality, still talking on quality, preventative care, long-term condition, next 3 months are crucial because although we've hit 87% of our core targets, the last 13% is still are the most challenging one because these patients have not been engaging in the text and email invites. So the teams are working in the background, focused on targeted calls. Child IMS an area where we've still not done very well, and this we know it's largely driven by a small proportion of patients who are not keen on vaccinations, but we have to keep trying our best. Hypertension smears are always challenging because the large volume of patients in the cohort. Diabetes, SMI are also driven by patient behavior, but these remain the key areas of concern for the next 3 months. We will also be delivering COVID booster vaccines with on-site at our surgeries, not at the PCN hubs, but at sites from April. So that's something to look forward to. We'll be working with the leads around the training requirements and vaccine storage and PGDs in due course. What we need from the teams on the ground is what we've always requested for. Please continue to reinforce the message. It's really important that patients attend their long-term condition reviews and preventative care appointments. We find that long-term condition reviews see the highest number of DNAs. Around 25% of the patients don't attend, and that's a big problem. Not only we're not able to provide care to them, but it's also blocking care to those who need it. And reception, again, to continue doing the vitals. This is making a difference with the doctor's consultation time. More to be done around quality. leadership and supervision, we pledge to increase, and we're on the right path. Steve will talk more about it. We've got some new members joining, but there are more vacancies coming up, like the lead GP vacancies at 4 or 5 of our sites. We need to do some work on auditing our clinical SOPs. It's been a while, and it's worth doing. In the next 3 months, we'll be working with the clinical directors very closely to do these audits. Documentation came up in the complaints and also comes up in some significant events. We'll be introducing AI to help with documentation. Now, this is not necessarily going to be the Heidi AI because there are lots of limitations around it, although that's on the cards. But there will be a version of AI built in by the Penrose and Hippo team. And that can be used to, for example, the most common time-saving task there would be drafting your referrals. EMIS housekeeping is something that I'm working on in the background with the IT team. We found lots of stray tasks and teams on EMIS, lots of out-of-date templates, and so you'll see some changes coming there in the next 2 or 3 months. We touched on significant events and complaints briefly, but these discussions need to be had at site level and function level. So Dr. Hawkswell and myself will be reaching out to the teams to arrange these meetings to go into the detail of the patterns, and also finalizing the functional level KPIs. Now, again, we talked about the shared goals, very high level, but how this impacts our day-to-day is linked with the KPIs. So we're finalizing that with the leads. So we have better benchmarking of expectations and performance, and we can clearly see day-to-day workflow and provide targeted support where it's needed. Now, these are all the updates from me, but I'm still around, but it's time for Steve to come in and give us update on our people's function. Steve.
Thanks, Karan. We've been hard at work over the last few months, filling gaps, adding new capacity. So we've added 10 heads to the workforce to make sure we've got the people that we need to deliver for our patients. And overall, we've done 28 hires. That's filling not only those new heads, but also people who have left and filling those gaps. We are also getting much better at quickly replacing people if they leave. So, of course, some roles take longer to recruit, but we're trying to get ahead. As Karen said, we're also adding 14 additional roles to the organisation, and I'll talk a little bit about the focus of those roles later on. When it comes to recruitment, we've changed the way we recruit. Adding in assessment centres when we're recruiting multiples of roles like call handlers, GP assistants, not only saving our time, but speeding up our hiring process and making sure that we test our candidates on work tasks so that we know up front whether they've got the skills to be effective on the job. It's meant that we've been able to get people who have come in and got up to speed a lot faster. We've also launched a new recruitment website, which we'd love you to go and have a look at. There we are, it appears. And the aim of that is to really help people better understand what we do at Penrose Health and what it's like to work here. And finally, we've been piloting a hiring local campaign to encourage local folks around our surgeries to apply for our roles. So moving then on to learning and our CQC readiness. Unfortunately, we aren't doing quite so well with our e-learning completion. As you can see, more than 75% of the organisation haven't completed all of their e-learning. So that's your red and yellow part of the pie chart. So my call out to you is please make sure you complete all your courses that have been allocated to you by the end of February. Compliance e-learning is not optional. It's an important part of our CQC compliance, so please do take the time to complete that. I'm also pleased to share that we are now a disability confident, committed organisation, and try and say that after a glass of wine. What does this mean? It means that we're committed to ensuring inclusive, accessible recruitment. We offer interviews to disabled people who meet the minimum criteria for our roles. we provide reasonable adjustments, we support our existing employees, and actively promote vacancies to attract disabled talent. This is part of a journey. So this is only the first step of our journey, but we're really excited to be taking part in this government scheme. Then on to my favourite topic, which is our pulse surveys. And at the last town hall, I launched our pulse surveys. And last month, more than 50% of you answered our only 4-question survey to help us understand how you're feeling as a team. And here's what you're telling us. In all areas, which are out of 5, just for your information, you're telling us that things are okay, but one of my roles is to make sure that we improve our workplace. And you've given us some really helpful feedback to help us understand what needs to change. So when I launched these pulse surveys at the end of last year, I promised that I'd report back. And whilst I can't go through every comment, lots of those comments fit into 5 themes. So I thought I'd take just a few minutes to take a look at each of those themes. Okay, so the first theme that I pulled out was staffing and support. And we've hired a lot of staff. As I said earlier, 28 staff since October to try and fill those gaps where people have left, and also to try and get ahead of the game and make sure we've got a better cover for you. We're also more and more trying to spend more time in surgeries as a CMT. So you hopefully have seen me out in surgeries each week. If people in Lewisham might recognise that I'm currently sat in the conference room in Lewisham. I was in Nightingale earlier on this morning, and I'm out in surgeries, at least one surgery a week. And Karen has also committed to spending time in surgeries as well. And we're encouraging other members of the CMT even to do the same thing, because we do think it's really important that you have a chance to come and talk to us, and we have a chance to talk to you. And I had a great conversation last Monday with a doctor who just saw me, wanted to have a quick chat, and I managed to answer some important questions which had been niggling for her. And so those opportunities are really important for us. The second theme is recognition and reward. So Priya has put together a plan on recognition and social activities, which she's going to be talking about later on. And I don't want to steal her thunder. So what I will say here is that we've listened to you. We understand that you want more kind of recognition, and we are trying to do that. And you'll see how in shortly. Third theme is well-being and engagement, and we've heard that you want a bigger focus on well-being. The rollout of our social recognition plan will help, and one of the big pieces of work that we've been doing over the last few months is hiring, to make sure that we have less of those gaps so that you don't feel that you have as much to pick up. We're not there totally. We're trying to make sure we monitor it through your manager, day-to-day feedback, but also through this work, through the pulse survey. So please do keep replying to the pulse survey. I know it's every month, and I know that it's very easy just to kind of go, oh, I'll do it later and then forget. But it's literally 4 questions, bit of a comment if you want to, but you don't have to. Just give us that feedback as soon as the email comes in. It really helps us understand how things are going. More will come around the well-being and engagement area in the coming months. Okay, so the fourth theme that came out really clearly when we launched the pulse survey back in November was around the triage centre. So I've asked Karen to just pop back on to talk about how we've been adjusting things to address concerns.
Thank you, Steve. Before I touch on this, just a quick note around the trainings. The donut chart there shows 75% of us haven't done our trainings. That doesn't mean you have lots of trainings pending. It might be you have 1 or 2 modules pending. So please don't think this is a mammoth of a task. Most of our colleagues have only got 1 or 2. I know that I've got 1 pending that I have to complete before end of February. So please do find the time. But coming back to the point here on the screen around patient triage, this is feedback that I've received from sites attending practice meetings, and we've also received in the last 6 months, we've received around 300 odd appointment feedbacks coming through our Asana form. They are being reviewed by the team. They are being reviewed by Claire. Credit to Claire. She got too many plates to spin. She's trying to do her best, and we are hiring more people to support her. But essentially, some of these we've been addressing as the feedback is coming. It could be simply a timing issue. A lot of the feedback around the inappropriate bookings are already in the pipeline for the postcards, we call them, the pathways to be reviewed. So we've not seen massive surprises there. Some have been linked to individual usage of trees, and that's being addressed by better training. Again, not seeing massive surprises there, but we are very grateful. Please, please, please keep doing that. I promise you, this is not falling into deaf ears. We are reviewing them, and I can dive into them in detail. I can give you themes around the with 300 odd feedback we received in our next town hall.
Thanks, Karen.
Thank you.
Okay, the final theme is around management. And we hear that it's really a theme for you guys in a number of different ways. And so we're addressing it in a number of different ways. First of all, we are hiring and promoting people into management roles. So here's a little bit of a good news slide. So we'd like to congratulate recent promotions. So Connie Shepherd, who's welcome team lead in Kingfisher. Emanuela, who's welcome team lead in Knights Hill. Bailey, who is being made the care navigation specialist in our triage hub. Carolina, who is a clinical admin specialist
Referrals team.
In the referrals team, and also Carolina, another Carolina, who is a clinical admin specialist in our referrals team as well. So congratulations. What I love is that we are giving people inside the organization the opportunity to progress. And so do keep your eyes open. When there are opportunities, I do try and post out on either specific groups or on teams, or I try and post out on the individual sites teams to make sure that you know when there's an opportunity. But also keep an eye on our recruitment website. It's new and exciting and looks kind of cool now, so do take a look. What we're also doing is we're hiring new managers, because what we know is that we don't have all the skills that we need in-house, so we do need to hire some in. So we've already hired Fahad, who's our head of AHPs, and he's been with us for a month or so. And then we have also hired a lady called Hayley Wong, who will be joining us next month as our lead pharmacist. But that's not it, because we're also hiring a deputy call center manager and a clinical admin manager to help provide more management support for those areas. And we're also now just started the recruitment. I sent a message out to the GPs. I think it was back end of last week. We're hiring for 4 GP leads. So if you are a GP and you are interested in taking on a lead role, then feel free to reach out or get your application in. I have sent a special link to your GP Teams chat, which you can use to apply, which means you don't have to fill in all of the forms. You just have to fill in some of it, because we already know you. What we're also doing is we're about to begin training on new managers to make sure that they set expectations clearly, they follow up, and they provide you with the support that you need to be successful in your role. Things don't necessarily happen immediately, but they are moving forwards. And I hope that in the coming weeks and months, you're going to be able to see that our investment here in management is starting to make a difference for you guys. What is really important for us is that you keep talking. We want to know what you think, and we are listening, and hopefully the last 5 minutes has really shown you that we are interested in what you've got to say. We are taking action off the back of it, and we'll be honest when you tell us something and we can't change it. Quick squirrel for you. So do keep talking to us. We've got lots of different routes that you can talk to us. So the pulse survey, as I said, it will be coming out in about 20 days. It'll come back out again. Practice meetings are a really good opportunity for you to feed back to your line manager, and that does come up as well, so that we can aggregate all of that information. Again, one-to-ones with your managers, because your managers are a great way of you feeding information up and in. And then finally, team meetings. Okay, so do engage with us, do give us your feedback, do keep talking to us. So looking forward, what have we got planned for a people team in the next few months? Well, we're going to hire those managers and start that training. Then we're going to make sure that everyone is clear on the expectations that we have of you through KPIs and objectives. We're going to continue to monitor that pulse survey, take actions quickly off the back of it. And you may have heard that there's a big change coming in employment law with the new Employment Rights Bill. So we're working really hard in the background to make sure that we're ready for that. And we're also looking at making some improvements in our sick pay provision later this year. So that's a little bit of a teaser for you. More to come in the coming months about what we're doing with that. So that's about it from me. And I'm now going to hand over to Priyanka.
Hi. Yeah. Okay. I have access now. Cool. Right. So let me
Yes.
click.
Yeah.
I'm clicking.
Okay.
Oh, there. Okay, there we go. Hi all. So yes, as Karen said, I'm like leading the growth and happiness. I'll say the happiness committee at Penrose. So we know Penrose is very busy and stressful, and you can deal with like angry patients and some, difficult patients and lots of admin load and people coming in and out, and you don't have a manager, like Steve said. It's stressful. Anyway, but I'm here to add some fun and make sure that there's small things that happen throughout the year that make you feel celebrated and you can bond with your team, not just like the big Christmas and party at the end of the year. And then it's also like things that aren't necessarily centered around drinking, because like I don't really drink, so like you might not drink, like you might not do it for religious reasons, for health, whatever, but like there's loads of fun things to do. Anyway. Oh, wait, I just clicked and it didn't click. Oh, there we go. Okay. So first off, introducing the social committee. There's one person from each site at least. So we've got Lauren from Kingfisher, Kelly from LMC, Natalie from Deptford, Stacey everywhere, Claire London Bridge, Teresa head office, me London Bridge, Connie Surrey Ducks, Jason Deptford, Emanuela Knights Hill, Steve also everywhere, and Amy Penrose and Maddock Way. So these people are to help me like get the message out when there's an event that comes up and help spread the word, but also for teams individually to ask them if they have any questions. If you're like scared to ask me, although I'm not scary at all, but if like you see them around and you're like, oh, is this happening or whatever, or oh, can we get this to, can we like organize this or whatever, then you can just ask them and then we can discuss it as like a committee. And if you want to join the committee, let me know as well. But yeah. In terms of the way that we're doing like the calendar, so there's going to be small things like seasonal treats. So that'll be like on Pancake Day, Easter, Halloween, NHS birthday, and you'll just see like little surprises come up in your team sites. So yeah, look out for those. There'll be well-being and people moments. So, well, okay, this is if you've completed all your compliance learning. As Dr. Hawkswell said, your PLT sessions should be used for that. So if you completed it all, then we will do meditation and yoga sessions. We did that last year, but yeah, we'll bring it back. And then the bigger moments, so that's like the Christmas and the summer party. and then recognition, which I'll come on to the next slide, and then cultural celebrations, because Penrose is so diverse, so we should be celebrating everybody. So Diwali, Pride, Black History Month. If like somebody here is like wants to celebrate their culture and I haven't like mentioned it or we're not doing anything specifically, please let me know. Like let me know how we can help and showcase your culture to everybody in the team. So just an example of like one of the small things we're doing is we are going to the theatre. So Southwark Playhouse in Elephant and Castle, which is like super nearby, is doing a musical about the discovery of penicillin and also a modern romance love story in a hospital, which I thought was quite apt. So I'm going to send out a form afterwards, which you can like vote for which dates you can do. And then I'll just pick the date that has the most people. And then I'll book like a group outing for us all. But yeah, I'm definitely going to go. So I hope you can too. Woo! The Penrose Cup. For those who've been around like a long time, you'll know that we did this like years back. And we're bringing it back because why not? It's really fun. And actually, somebody mentioned, like, they basically mentioned the Penrose Cup without saying the Penrose Cup because they didn't know we did a Penrose Cup. So I was like, yeah, we should bring it back. But it's really fun and it involves all the sites, and each site is like their own team, and it will be like challenges throughout the year, so like step challenges or like bake-offs and like sports day. But it's not only how well you do in each activity, it's also how many people in your team are participating. That's where you also get points for. So like you can be rubbish, but if you get more people joining, like that's even better. I made some cute little logos for each of the teams. It's like based on what Sachin created like ages ago, but I've jazzed it up with the help of AI. And I hope you like your colours because there might be t-shirts. Might be. So yeah, like I said, there'll be the summer party and there'll be a Christmas party. Because obviously we have like a budget per person, we can't like, oh, the screen's gone. Because we can't so we have a budget per person, so we can't like do a massive summer party and a massive Christmas party because that just wouldn't work, especially with all the tiny things we're doing as well throughout the year. So we're keeping our Christmas one as quite like fancy and jazzy and nice, and then our summer party is going to be like more relaxed, so probably more along the lines of like a sports day in a park somewhere, or maybe like a private field. Not really sure yet, but that's kind of where we're vibing. And then every quarter, we're going to select one team. Leadership is going to select one team who thinks that they've done like a really good job of like smashing, whatever target they needed to. Whatever target they needed to. And you guys will get the opportunity to choose whatever activity you want, and we'll organize it for you, and you get to just go out with your team and have a great bonding sesh, and it's like a little reward because you really like smashed it out the park. So yeah, that should be a little motivation. Oh yeah, those are some pictures from the recent quarterly team outing, which were Claire's and Priya's team. Yeah, they went to Electric Shuffle. And then in terms of recognition and rewards, so firstly, we're going to do monthly rolling rewards. So these will be nominations across all the departments, and your like department leads will send them to Curran, and then he will choose 5 people. So that will be from GPs, call handling, welcome team, GPAs, and AHPs. Yeah. And then those 5 people every month will get a £50 Amazon voucher because they've gone above and beyond in their role. Yeah. All the department leads know about it. So yeah, they'll be like looking at whoever's doing really well. And then at the end of the year, we'll have an annual award ceremony, which will be a bit more like pomp and circumstance. And we'll celebrate, you know, the staff member who's just been the best throughout the year. We haven't really decided on the categories yet, but like thinking like best throughout the year, and obviously like staff who've been around, you know, 10 plus years and whatever. And just, yeah, a way to just honor people who've really just done really well in Penrose altogether over the year. Oh, this would be fun. I don't know if it'll play. Oh, will it play? This is the Christmas party video. I don't know if it will like buffer, but we'll try. Does the volume work? Oh no, is the volume not working? Oh, that's sad. Okay. The volume's not working, so I'll just send it in a link afterwards. But basically, the videos and the photos are here, so yay. So essentially, calendar invites are going to be coming. Booking forms are going to be coming. Please keep an eye on them. Please save the dates in your calendar. The more I hear from you guys, and the more like, you know, you are like, yeah, I like this, or you're like going to events, the more I'm going to organize stuff. Because if I don't really hear anything back, or like, you know, I'm getting like 2 people coming to something, I'm like, okay, clearly the team doesn't really want to do this. I'm not going to bother organizing it in the future. But yeah, talk to me whenever you want, like Teams me, calls me, whatever. Talk to your social committee site person. Yeah, that's basically it.
Thank you. Thank you, Priyanka. That was amazing. So a lot of work has gone behind the scenes. Priyanka's been working on this for the last 3-4 weeks. Thank you. That's it from us today, team. Thank you for joining. You've got a lot of work. We've all got work to do. I hope you get some time for lunch breaks. We will share the recording and link to the slideshow soon, and we will see you soon, very, very shortly. Like Steve said, Steve's visiting sites, Dr. Hoxel is visiting sites. Mr. Gupta's currently away, but when he's back, he's also visiting sites. I am committed to visit sites every week. I go to one surgery now. And I will be joining all the practice meetings in future. Thank you. See you soon.